Hi there, in this video, I'm going to show you some simple home remedies that you can use to baby constipation and tics. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. Constipation can affect children and, in rare cases, babies, just as it can adults. Though it is normal for babies to have fewer bowel movements than expected, many parents wonder if their baby is constipated when she poops less frequently. Discover some of the telltale signs of constipation and how to help your constipated baby. What is baby constipation? To understand baby constipation, you must first understand what infant stools look like. Although each baby is unique and there is a wide range of what is considered normal when it comes to pooping, many babies will poop after each feeding in the first few weeks of life. After about 3 to 6 weeks of age, some breastfed babies will poop less frequently, even once a week. This is due to the fact that breast milk produces almost no solid waste that must be eliminated from the digestive system. Formula-fed babies typically poop once or twice a day. When everything is normal and consistent, your baby's stools should be soft, like peanut butter. If your baby has hard, dry bowel movements that are difficult or painful to pass, she may be constipated. Furthermore, if your baby is constipated, her bowel movements may be less frequent than what is typical or normal for your baby. What is the cause of infant constipation? Constipation is uncommon in newborns, especially those who are not yet eating solid foods. It is more likely to occur in your baby once solids are introduced. Your baby's bowel movement pattern will vary depending on his age and what he's recently eaten. Your baby's constipation may be caused by an underlying condition such as Hirschsprung's disease, hypothyroidism, or cystic fibrosis in very rare cases. If you suspect your baby is constipated as a result of any of these conditions, or if you have any questions about his symptoms, contact his healthcare provider. How long can your baby avoid pooping? The frequency of your baby's bowel movements will vary from day to day, and each baby is unique. A baby who is fed formula will poop at least once per day, but she may go without poop for a day or two without becoming constipated. Breastfed babies may poop more frequently in the early weeks because breast milk is easily digested, but by 3 to 6 weeks old, breastfed babies may have fewer bowel movements, with as few as 1 or 2 per week, but are not constipated. What can you give your baby if he is constipated? If dietary changes haven't relieved your baby's constipation, your baby's healthcare provider may recommend an infant glycerin suppository, which is placed in your baby's rectum. These suppositories are intended to be used only on occasion and should not be overused. To treat your baby's constipation, do not use mineral oil, enemas, constipation medicine, or any stimulating laxatives. Always follow the advice of your healthcare provider. When should you contact your baby's physician? You may be wondering, when should I be concerned about my baby's constipation? Certain signs and symptoms to look out for can indicate that more urgent medical care is required. If you notice any of the following symptoms, contact your baby's healthcare provider right away so that your child can be examined. Constipation is more likely to occur after your baby first begins eating solid foods, around 6 months of age. It takes time to adjust to new foods, which can result in constipation on occasion. Otherwise, constipation in babies is uncommon, so it's possible that your baby is simply going a few days without a bowel movement and isn't constipated. Knowing what symptoms to look for, such as palate-like poop, can be extremely helpful in determining the severity of the situation. Although constipation can be distressing for your baby, especially if she is straining to poop, a simple treatment may suffice. Subtle dietary changes, such as adding fiber-rich foods or offering a little water, can help relieve constipation. If these dietary changes don't help, talk to your baby's doctor, who may recommend suppositories or another form of treatment.